Hey everyone, this is Nana again. I'm one of the midwives here at North Atlanta, and welcome to Tip Tuesdays. I wanted to talk to you about preterm labor today. What are the signs, when to come into labor and delivery, when to give us a call, and kind of compare it to what true labor versus false labor looks like. So, preterm labor is basically having signs of labor before 37 weeks. So before 37 weeks, you're considered preterm. After 37 weeks, then you're considered full term. So preterm labor essentially just means you're having regular, consistent contractions, at least 5 to 6 minutes apart, lasting for an hour or two, and it's causing your cervix to change. Some of the signs also include your water breaking, increase in discharge or bleeding. Those are kind of like the signs that we look for. So when you come over to triage labor and delivery, we do a series of tests to rule out preterm labor. So we do what we call a wet prep and a urinalysis, as well as STI testing if you haven't had that done prior. So with the wet prep, we look for bacterial infections, other infections such as bacterial vaginosis, yeast, trichomonas. And with the urinalysis, we take a sample of your urine and then we look at how dehydrated you are, any bacteria, any kind of signs that you may have a UTI. So those are the things that we look for in our testing. So when you come over to triage, we put you on the monitor to get a look at where your contractions are looking like. We go ahead and also do a cervical exam to see if the contractions are causing your cervix to change. And then if any of those tests come back positive, then we treat you. So if you're having a UTI, we give you antibiotics for that, depending on what the culture results look like. If your urine is showing that you're dehydrated, we give you IV fluids. And then if you have bacterial vaginosis, trichomonas, and all of that, we give you antibiotics, treat those as well. Most of the time, once you are treated, the contractions pretty much go away and then you feel much better. So that's kind of what we do to rule out preterm labor. Now, there's a difference between being in true labor and then false labor. So false labor is pretty much Braxton Hicks. It comes and goes. Some people report it as their belly getting tight or mild period cramps. So it's common to have that throughout pregnancy for most people. For other people, they usually start having that during the 3rd trimester, once you're kind of closer to delivery. And some people may not have that at all. So if you are finding that you're kind of not in that window where your contractions are consistent, super painful, you're having severe pain, once again, your water's breaking, you're bleeding, those are the signs of true labor. And then once again, you come to triage, we check your cervix and see kind of what's going on. There are times where, all the tests that we do come back negative, but you're still contracting frequently and your cervix is not changing. So what we usually do is we still keep you in triage for a couple hours or so, kind of make you comfortable with pain meds, see if your cervix is changing. If it's not changing, then we send you home with precautions and when to come back to triage. So that's pretty much it in terms of preterm labor and true labor and all the signs to look for. Let us know if you have any questions or concerns.